Welcome, everyone. Sorry for the delay. I'm Jim Rosenberger, a member of the Ingram-Oken Forum Committee, and along with Ling Jiao Shu from Penn State and Charles Loeffler from University of Penn, we've organized this two-day event, virtual event. Invited persons involved with gun research have been invited to this forum and also to submit chapters to the upcoming volume on statistical aspects of gun violence. Very briefly, the National Institute of Statistical Sciences created the Ingram-Oken Forum series named after Ingram-Oken, who was involved with the founding of NIST more than 30 years ago. These forums focus on current societal issues that could benefit from attention from the statistical community, hence statistics serving society. The Ingram-Oken Forum series began with an inaugural event in June 2019 on gun violence, the statistical issues held in Washington, D.C. Today's event is a follow-up on this event, the second Ingram-Oken Forum workshop on gun violence. The Ingram-Oken Committee is chaired by Wendy Martinez of the U.S. Bureau of Census, who unfortunately could not be with us today, which is why I'm opening this event. The current NIST director, Dave Madison from Cornell University, will join us on the day 2 of the forum next Friday, May 17th. Other Ingram-Oken forums included topics such as unplanned clinical trial disruptions, algorithmic fairness and social justice, COVID in the schools. These were all virtual events due to the COVID pandemic. But recent in-person forums included advancing demographic equity and privacy-preferring methodologies held at the Urban Institute in Washington, D.C., and most recently, statistical challenges in the analysis of police use of force, which was held at Carleton College. More information on these events are available at the NIST website and the NIST YouTube channel. So today's event has three one-hour sessions separated by short 5-minute breaks. Next Friday, there'll be 2 sessions plus a breakout room event where we can discuss these issues further. So with that, I hope we're still on schedule. I would like to introduce Dr. Wayne Osgood, who will chair this session. He's Professor Emeritus of Criminology and Sociology at Pennsylvania State University, which he joined in 1996. Briefly, he's a fellow of the American Society of Criminology and received its Sutherland Award for Scholarly Achievement in 2022, and was lead editor of the journal Criminology for 2012 through 2017. And he also served on the editorial boards of Criminology and Public Policy, Journal of Quantitative Criminology.
So our first speaker is Susan Parker, a postdoctoral research fellow at Northeastern University. So take it away, Susan.
Great. So, well, it takes me the mandatory 2 minutes to remember how to put this in full screen for everyone. What I'll just say is that this is really building. I'll be talking about our non-fatal firearm surveillance data in the U.S. And this is really building on work that comes from a lot of different sources that we are very beholden to for this presentation. Certainly, this is work with Phil Cook and John Roman. It's based off of existing blueprints for firearm data infrastructure in the U.S. And so, fit to window, I think, is what I'm looking for.
At the bottom, there's what looks like a screen. I think if you click that, it should work. There you go.
All right,
Perfect.
Great. Thank you. Okay. I'm Susan Parker. I'm a postdoctoral research fellow at Northeastern University. What I'm going to talk about today is, at the most basic level, why do we need firearm injury surveillance data? What do we have? And how do we go forward? What do we really need? Certainly, this is an audience that's very familiar with the firearm injury problem, but really it's worth mentioning that within the last decade, after reaching really a historic low in 2014, we've seen very sharp spikes in firearm homicide. We're able to measure firearm homicide annually. We capture every firearm homicide in the US through various surveillance systems. And yet, non-fatal firearm injuries are actually much more prevalent. Each year, approximately 100 to 110 individuals are treated for non-fatal firearm injuries in emergency departments. Of course, preventing the majority of these firearm injuries would require timely and accurate data to inform prevention efforts. And while we have some of that with homicide data, and certainly it's a very lagged measure, we really just don't have this with non-fatal firearm injury data, despite the fact that it is more prevalent. And just to underline this, I'm introducing, the number of non-fatal firearm injuries, but just to be clear, like these figures come from a national survey of emergency departments. This is not a precise estimate of non-fatal firearm injuries. This is an estimate that comes with a wide confidence interval depending on the data set you use, and the most recent data is available in 2022. I haven't actually even seen it in a publication. I checked to see if anyone has updated this. And so really this is just to underline, we don't have precise non-fatal firearm injury data. We don't have recent non-fatal firearm injury data, and we don't know much about these individuals. This is a survey-based estimate. And this is a big gap in our firearm data infrastructure. So in practice, what does this data gap prevent us from knowing? It's really fairly substantial. We really can't answer questions like how many people are shot. As I said, that estimate comes from a survey of emergency departments. We don't know if this is trending upward or downward when we just rely on national estimates. We don't know much about the circumstances under which individuals are shot. Sometimes we might have information about where they reside or in what police jurisdiction the injury might occur. But this really hampers our understanding of the majority of gun injuries in the US, the ones that don't result in a fatality. It's also worth thinking about where these data sources, if we want to think about like, what should this look like? Where does this information currently reside and what would be needed to bring it together? And it's clear that among these important questions, sources that we would depend upon to answer these questions rely both in police data sources and in health data sources. So health data could tell us about the circumstances under which all individuals are shot, because if you're shot, you're very likely to visit the ER from what we know and from a few surveys. And you're very likely to visit regardless if this is a criminal assault or if this is an accidental injury. And so that's a really distinguishing feature of health sources, which is to say that if you were shot, you go to the ER, and we have a broad census of all types of firearm injuries. Yeah, and certainly this kind of health data could tell us information about what's trending upward and downward, and longitudinally, do we have reliable measures of gun violence? But other questions that are unique to non-fatal firearm injuries are only answerable in police data. That's to say that police collect systematic information about who perpetrates shootings and robberies. And this information is invaluable and really only relevant to non-fatal firearm injuries where there is a survivor who may have valuable information about the perpetrator often. And this kind of uniqueness of non-fatal firearm injury data is really only available in police data sources. And so as we think about what should this look like, it's clear that both of these sources are valuable and provide valuable context that we critically lack for non-fatal shootings. So as I said, health data is all-encompassing of firearm injuries. When we think about an individual who was shot, we think that we get most of them in the ED. That's to say that you could show up with a gunshot wound. We think that these are often coded, even though this is not reimbursable in a medical claims environment. The coding is comprehensive. There are associations of medical coders, and we think that we get reliable measures of all gun injuries. And And what we don't get, however, with health data sources that I'll skip to in a minute is reliable intent circumstances for all injuries. There's some conflation. I'll talk about that in a moment. But what's clear with these health data sources that I think is the big takeaway is that we often rely on large national surveys. There is state level data available. It's very expensive and difficult to aggregate. And so while health data may have really good attributes in terms of everyone who is shot goes to the ER, so we capture all sorts of intent and circumstances, we don't have this aggregated in a way that enables us to do individual level data collection currently. So just to give a bit more landscape of how many individuals are treated, what we think in emergency departments, using case fatality rates rather than hospital data coding, which is problematic, we think that around 85,000 on average of these 100,000 gunshot injuries that are treated in emergency departments, the majority of them are stemming from interpersonal assaults. Another 4,000 are from suicide and self-harm. Unintentional injuries as well are much less prevalent than assault, but tend to be overcoded, as I'll show in a moment. But as is clear, health data does capture this census of all intent circumstances. They are not, however, very reliably recorded in the health data systems as we currently have them. This chart depicts the various sources of emergency department records of gunshot wounds, and the shading is according to the intent of the injury. And what's clear is that on the left-hand side, the National Emergency Department database, this is the national sample where we get the volume of non-fatal gunshot wounds. What you can see is that assaults and accidents look to be about even in proportion. This does not match any of the other sources of firearm emergency department data that we have. And these sources, we have good reason to think, are more reliably coded due to additional review on the part of medical abstractors, as is in the case in the second bar with the National Electronic Injury Surveillance System, or frankly, just the National Trauma Data Bank also has a greater investment in abstractors. And so while we're learning about the causes of this coding problem in most health data, which will resemble NEDS and this emergency department sample with this kind of 50-50 breakout, which is not, we think, accurate. NEDS is what most of the existing emergency department records will look like most likely, and so health data has a substantial limitation in terms of being able to properly record the intent of an injury. So moving on to police data sources. Police data sources measure firearm injury differently. And this different measure is worth thinking about and highlighting. Because when a firearm injury, when a firearm related crime is recorded by police, police record crimes that occur with a gun, and crimes that occur with a gun can occur not just when an individual is shot and treated in an emergency department, but it can be used when a firearm is used to physically threaten, rob or assault someone, and it doesn't necessarily have to result in injury. The burden of harm is much higher, to the tune of 300,000 firearm and robberies and assaults committed annually. And when we compare that to an emergency department at the bottom, right, like 85,000 of the approximately 100,000 non-fatal gunshot wounds result in injury. And so police in some ways have a really expansive view of gun violence that isn't just about injury, and is valuable in a different context of measuring gun violence that results not just in injury. The current data system, well, this is the legacy data system. I'll get to the new current data system in a moment. But what we've recorded in police data is whether or not a robbery is committed with a firearm, whether or not an assault is committed with a firearm. And that's it. We don't have information and have not had information for many years about other outcomes that could result from a non-fatal firearm injury. But now, after its adoption in 2020, the National Incident-Based Reporting System is what agencies are very, this is the mandatory new crime surveillance system, if you will, for gunshot wounds or for gunshot crimes in the US. It took over from the prior system in 2020. There have been lots of issues getting agencies online. It's a very difficult system to report to. But what it does offer is it offers incident level crime data with great detail and lots of granularity, which is to say that we get information about the individuals who are involved with a gun crime. We get information about the perpetrators, whether or not there's an arrest involved in the gunshot crime, in the gun crime, whether it's a robbery, whether it's an assault. This is a really valuable source, though, as I said, it is not yet universal. But not only is this source valuable in its detail, but the FBI has proposed and accepted 2 changes that will make it even more valuable going forward. So in March of 2023, the FBI approved 2 changes. One, it approved police agency record keeping around whether or not a gun is just discharged in the course of a robbery or an assault. And as well, currently the police agencies don't have the option to include a gunshot wound specifically in the course of an assault or robbery. The current coding consists of this is a serious injury, lacerations, or other things that don't specifically denote gunshot wound. And so we don't have that precise measure in police data yet. But as I said, these 2 changes are approved. That is the good news. And so this really opens the door to a lot of nuance coming from police data. So not only is it about, in contrast to emergency departments, we'll capture information about verbal threats with a gun that don't result in injury. We'll capture information about firearm discharges and the type of injury. So these changes get us information about the gunshot wound itself. And these changes get us a lot of information about the discharge of a firearm. And so this level of nuance that the FBI has approved for recording information about gun injuries and gun crime in the US is a step forward in a way that could add a lot to our understanding of gun violence. However, NIBRS is not adopted nationally. It's about 75% of the population right now that is covered by NIBRS. So agencies have a very difficult time reporting to it, in particular small agencies, because NIBRS is a very complex data system. But it's not only the reporting problem right now that is a challenge, it's also the fact that implementing changes to NIBRS is really difficult. Lots of changes are currently underway. And this takes time for agencies to start tracking gunshot wounds, to start tracking information about gun discharge. And so this is not yet approved in the 2024 NIBRS technical specifications, and it's not clear when it will be approved. So briefly, the takeaways are that health data may have really expansive information about the injury intent coding. They may be more timely, they may be more expansive. They can't record injury intent properly. Police data lack a national sample, but do have valuable information about assault outcomes, and as well information critically about perpetrators and survivors that will help us learn more about efforts to solve gun crime, for instance, and all sorts of longitudinal analysis of policies to reduce and improve gun violence outcomes. I'm just going to end in my last kind of 30 seconds or so with just thinking about what do we want surveillance for and how does this guide what kind of data we use. We want to know if gun violence is increasing, and we want to know quickly. That might be a really nice source for health data records, right? Because like certain cities have high rates of gun violence. We want to know we fundamentally want to know when is it increasing so that we can do something about that. We want to know epidemiological rich information about what increases risk for gun violence, what protects you from gun violence in sort of a public health context. But inclusion of police data really is essential to understand attributes about whether this crime is solved, what happens to the perpetrator, what is the nature of that crime. And then finally, we want this kind of data to inform longitudinal policy analysis so that we understand what does work to reduce gun violence. as I said, these may not be the same source, but the good news is that there are models out there that bring together health data sources and police data sources that may be valuable in helping us build this non-fatal firearm infrastructure. So I think I'm out of time. Thank you.
Thank you, Susan. Appreciate it, your timeliness and very interesting talk. Let's move right on to Charles Loeffler.
Thanks, Wayne, and thank you also, Susan, for that great first talk. Can everyone see my screen okay? My slides? Great. So this talk is some early research, and it's focused on another piece of the puzzle of understanding contemporary gun violence in the United States. And that piece of the puzzle is ammunition. How ammunition ends up diverted from the legal market for its sale and use into the hands of prohibited possessors and its use for perpetrating gun violence, particularly other directed gun violence. So in terms of the structure that I'm going to do, I'm going to sort of walk you through some conceptual models that we have on sort of diversion of firearms and ammunition, the utility of those models for thinking about the particular case, understudied case of ammunition, some proposed metrics that we could be using, and sources of data that would allow us to use these metrics to create both real-time and longitudinal understandings of this aspect of the supply chain, essentially for gun violence. And I'll provide you some examples as well. So when we think about how firearms particularly get from this sort of legal market that we have in every US state into the hands of individuals who are at most at risk of perpetrating particularly sort of stranger, other directed gun violence, we have sort of two conceptual models out there. So one of these I've labeled on the slides the thick market hypothesis. And you can see this pull-out quote from a 1992 article. This is sort of the moment at which there was this big transition. You had a proliferation of firearms, in particular, a shift from revolvers to semi-automatics and to higher caliber firearms in the illegal market for firearms. And so we see an individual saying, essentially in Chicago, at a time where there were still organized gangs, essentially getting a firearm, it's like going through the drive-through window, give me some fries, a Coke, and a 9mm. So this is sort of the situation based at least on qualitative interviews that we understood for sort of firearms at this particular moment in time. Now we can sort of look at a few different sources of information. And I've pulled out one particular quote from a recent study on New York, which has a slightly different market structure for firearms and ammunition, but illustrates this sort of other hypothesis, the idea that actually it's much more difficult or at least time consuming because of search costs and enforcement costs for individuals to obtain firearms. So here we have individuals who are being asked about their experience with getting weapons, and essentially said, a lot of them said it would be relatively difficult to obtain a firearm. And this is something that we can also see in qualitative interviews in other cities. And so what you notice is a couple challenges that we already have. One, we have some pretty different conceptualizations about the ease with which weapons are diverted into illegal markets. And also what you'll see from these pullout quotes is that most of the examples that we have actually come from qualitative research. And that's in part because we struggle a lot with coming up with quantitative measures for some of these different hypotheses and the relevant policy reactions to them. And so, when just to sort of dramatize this a little bit more, we can see this sort of same example when we pull out studies from actually across the world. So we can see studies in Chicago from the early 2000s in which people are reporting huge markups on purchasing ammunition in Chicago. Something similarly found in the United Kingdom, in similarly timed study. And then we can look over at such diverse places as Los Angeles in a 2017 study where jail inmates were interviewed. And you see the table from that below, where they're asked essentially like, where do you get ammo? Where can it be purchased? And these are all people sitting in jail for illegal possession. And, essentially the majority of them are saying, yeah, I just go to a store. And that's in part because of sort of regulatory, lower regulatory burdens with respect to purchase of ammunition. And we actually see in the Netherlands some diversion of ammunition in the context of sporting clubs, where regulation is at an abstract level pretty large, but in a real practical sense, a lot smaller. So now we have this, competing conceptual models. We're using, different data sources, a lot of it qualitative, to study this. And so this really limits model testing, policy evaluation as a practical matter. So this sort of motivated the talk you're hearing to think about what are other sources of information we could use to examine this question of market thinness and the supply chain for ammunition. So the key insight for this talk is that actually we have another source of information. It's routinely available. Susan sort of alluded to the value of police information for making sense of the extent of gun violence problem. And that's actually true also of ammunition. And so what you see here is the total number of recovered firearms that are sent to the ATF, alcohol, tobacco, and firearm, for gun tracing to determine the original location of their point of sale. And what we see is we have a huge number of these firearms. Well, this also means in practice that in all of these recovered firearms are in police possession, and potentially we could learn something about the nature of certainly ammunition from the fact that most of these guns are not recovered after active shootings, but in fact as part of routine traffic stops and other law enforcement actions. So we could explore this distribution to better understand this sort of the degree of supply constraint in the diversion markets. And so the particular source of data that you're going to see now is sort of the first exploratory effort that we engage in, was actually recognizing that a lot of police departments actually publish almost all of the information on recovered firearms to social media. And they do this as a way of signaling to the public their commitment to enforcing gun laws and trying to take illegal firearms off the street. And so this is a very typical example you'll see from the Boston Police Department, where they describe the details, the circumstances of a firearm recovery. And also you notice that they're showing a highly resolution photo of the firearm recovered, as well as this ammunition that was recovered in the firearm. Now, so you can tell it's quite a lot of ammunition. So the intuition that we had is we could actually take these sort of images and this provided information that's publicly available, and we could use that as a way of developing a couple different metrics for the scarcity of firearm ammunition in illegal markets. And we do this by essentially, literally, going through these pictures, counting the capacity of these weapons, as well as the number of rounds observed in each of these weapons, and developing basic metrics for the fullness of weapons. So what you see here is a Ruger. It has a capacity of 7 rounds, and also you can have 1 additional round in the chamber. In this case, this recovered firearm was found to have a complete magazine, as well as a chambered round. So this is not just full, it's extra full in some sense. And when we look across sort of all the firearms recovered in this period of initial inquiry in 2023 in Boston, of about 194 of these recovered firearms, we see that about 174 have sufficient detail to infer sort of load levels, which is our sort of first proposed metric. And when we compute this metric, we see that essentially a majority, just over a majority, were fully loaded. And then we see another plurality was substantially loaded, 80 to essentially 99%. And you can see things go down. We also notice that essentially very few are empty. And this is sort of, if you want the full empirical distribution, this is actually what it looks like in practice. Now, when we look at this, you may be thinking, okay, this is useful, but a bunch of these firearms are going to be recovered after shooting, so we should expect their load levels to be lower. We might also imagine that there's some omitted variable bias, or at least correlation between the circumstances of recovery and the extent of fullness in a firearm. And so one of the next things that we do is essentially look at whether the mode of recovery seems to be at all correlated with the empirical distribution that is observed. And so in particular, if you think about the first and largest category here in the upper left graph, what you're seeing is that same empirical distribution, but only for those firearms that are recovered in a public search, right? That could be a car stop, that could be a pedestrian stop, where a police stop someone and do a Terry stop, inspect, recover a firearm, and then inventory how much ammunition is found in there. And that distribution is pretty darn similar to the overall distribution. It really drives it. That's the first thing. And the second thing we see is, searches of private homes. These are warrant searches, very similar distribution. And then the final graph I have here is report of a gun or shooting. Most of these are actually report of a gun, not report after a shooting. Later on, we'll be able to break that out more, and we'll hopefully see that has a different empirical distribution, as we'd expect. The other thing that we can do, and Wayne's telling me I have about 5 minutes left, so I'll be a little bit quicker, is we can actually create a measure of scrounging. So if we think about a sort of illegal market, there's a lot of search costs associated with bringing ammunition together. And so one way we can assess the supply constraints in this market is to look at the variety of ammunition that's actually recovered in particular firearms. So if you look at this same picture and look very carefully, if you have keen eyes, you'll notice that there are actually 2 different types of ammunition that were observed in this particular firearm. And when we look over that whole empirical distribution, what we notice is just under a majority only have one type of ammo found in them. And then about a third have 2 or more types of ammunition. And interestingly, a final third have 3 or more. So this is something that we interpret in our working paper on this as evidence of scrounging rather than some sort of taste preference to have more types of ammunition, that more effort, someone had to aggregate that ammunition. So that represents another measure of supply constraint. And then when we sort of look by, we take our 2 measures and we look empirically at how correlated they are, we really don't see a lot of variance across these. So the fullness metric is pretty similar across these different measures of scrounging. Now, when we think about other things that we could learn from this, there's actually quite a bit more about the sort of user intent than just carrying a firearm. And in particular, we can observe that roughly half of these firearms were recovered with a chambered round. So these are essentially our ready-to-go weapons, and about half are not. So although you'll hear stories in qualitative studies that really say a lot of people are carrying weapons just to posture, and as evidence of that, they'll self-report that their weapons are empty. That's really something that we don't tend to empirically observe. And we also tend to observe that a lot of them are essentially ready to go. So takeaways. How often are illegal possessors able to completely fill their weapons? Quite often. How often do they need to scrounge? It's about a third of the time that we see evidence of scrounging. And then when we look at these other attributes, brandishing, not common, not observed, weapons are often ready to go. And the transaction costs seem to be not really high enough if we think about this, even in a high regulatory environment like Boston. So just to close, we're still working on this work, refining some of these measures, looking at multi-jurisdictional comparisons, and then trying to put this framework into use for evaluating the emerging number of ammunition restrictions that in California and other jurisdictions are one of the policy frontiers that are being proposed as well. So thank you.
Thank you, Charles. And that was very timely. Well done staying within these tight constraints. Our next speaker is Iris Horn, who is also from the University of Pennsylvania. Take it away, Iris.
Hello, thanks for the introduction. So today I'll be talking about probabilistic record linkage of two gun violence data sets. So just to start with some background, so studies have found that racial disparities exist for gun homicide deaths in the US. So specifically, the 2003 to 2017 age-adjusted rate was 7.4 times higher for Black individuals than for white individuals. And this is what the CDC found. And so this shows us that maybe race has some factor in the gun homicide death rates. So because race is often associated with poverty, maybe possible methods to try to alleviate or try to reduce gun violence homicide deaths could be to try to look at the poverty issue in the United States. However, another study found that in Philadelphia, Black individuals of the same income level as white individuals were at higher risk of being shot. So this means that even though the Black individuals had the same income level, it seems that we still saw higher gun homicide death rates for Black individuals compared to white individuals. So to try to look more into this relationship, a recent paper published in 2020 looked at the relationship between the neighborhood racial composition and gun homicides. So they used data from the Gun Violence Archive, also called the GVA, and that data set contains local information to the neighborhood level. So they defined what's called a deprivation index to be a 0 to 1 scale based on poverty rate, median household income, and so on. And the study found that regardless of deprivation index, gun homicide deaths increased with higher proportion of Black residents. So this is a really significant finding, but there were some limitations of the study due to their inability to incorporate the demographic details of the perpetrator and victims of the crime. This limitation is important to consider because of something called the spillover effect, which is that racial segregation of neighborhoods could mean that wealthier Black neighborhoods are still geographically closer to the lower income Black neighborhoods. So it could be that because these wealthier Black neighborhoods are still close to the lower income Black neighborhoods, that's why the study found that gun homicide deaths still increased with higher proportion of Black residents. So in order to try to address this limitation, we decided in this study to try to look at two gun violence data sets that have different strengths. So right now I'm using the Gun Violence Archive, just like the previous study, because it provides neighborhood-specific data. However, as I mentioned, it lacks demographic details of the perpetrators and victims of the crime. So the second data set that we're going to consider is called the National Violent Death Reporting System, or NVDRS. And this will be useful to us because it contains very detailed narratives and demographic characteristics of the people affected and very event-specific details for each incident. So our goal right now is to try to use probabilistic record linkage to try to link the GVA dataset with the NVDRS, because this will help enable studies to combine the strengths of both of these datasets. The NVDRS with its more detailed narratives and demographic details of the people affected, combined with the specific neighborhood level information given by the GVA. So how are we going to link these two datasets? So in general, when we're trying to merge two datasets, there are different techniques. For example, the most simple technique is to try to find a unique identifier that could link records from different sets. So if these two data sets have the same column name, then we could just merge based on that unique identifier. However, this is not really practical, or this doesn't often show up in a lot of data sets. And so another technique to try to use is called deterministic matching. So this is where we define specific rules to determine which rows we want to consider as matches. So for example, we could say that two records are a match only if they have the same address where the gun violence incident happened. However, there's a con to this method because it's prone to measurement errors, such as misspelling. So if one address is just spelled has just a misspelling compared to the address in a different record, as humans, we know that these are probably the same incident. They happen around the same area. But because of that small misspelling, this method would say that they're not a match because they are not the same exact address. So in order to address this measurement error, there's another type called probabilistic matching. And this uses likelihood ratio theory. So it assigns comparison outcomes to the more likely decision. So even if one of the addresses was misspelled a little bit, it would say that most of the rest of the address is about the same so that they could be matches. And so the pro of this method is that it quantifies the uncertainty that's already inherent in matching. So with this probabilistic record linkage, how does it work? So the canonical model is that, say we have a data set capital A and another data set capital B, and they each have these variables, like for example, the first name of the victim of the gun violence incident or the address of the incident and so on. These are all the variables or their column names. We can define this gamma sub k of ij to be the discrete level of within pair similarity for the kth variable between the IOF observation of dataset A and the JAIF observation of dataset B. So we're looking at two records, one from the dataset A, one from the dataset B, and we're seeing with these records how many of their columns or how many of their variables are the same, and like how similar are they. So that's defined as this gamma. Then we have capital M sub ij, which indicates whether a pair of records is a match. So if it is a match, then capital M would be 1. If they're not a match, then it would be 0. And we define this finite mixture structure to be our model, where we have this gamma conditional model, where we have gamma given capital M. Now, there does sometimes seem to be a problem in this like probabilistic record linkage, which is that how are we going to treat missing data? So sometimes some researchers treat it as disagreements. So like if there's missing data, then those two records can't be matches. However, there's a little bit of a limitation with this because two records might be a true match and they just happen to have some missing values. So in order to address this issue, a recent paper by Enamorado found a solution where they tried to assume the data are missing at random, or MAR, conditional on the capital M. So under this MAR assumption, they just ignore the missing data. So even if there's missing data, it's still possible for two records to be a match. With this, they define a observed data likelihood function of the model to be the following formula, where we see that they estimate the model parameters using expectation maximization algorithm. After they define this likelihood function, they can then compute a match probability for each of the pairs using Bayes' rule. So for an IOF observation of dataset A and a JAIF observation of dataset B, they can see what is the probability that given these two records, what is the probability that they are a match? And they use this formula to do that. So we use this model, and this model they actually call something called FastLink. So this R package is called FastLink, which implements the probabilistic record linkage model that I talked about before. Specifically, how do they merge the data sets? They merge them based on similarities in the variables. So if we have strings, then they match on character similarity using the Jarrow-Winkler string distance. So here I have an example where I put two words. The lower one is Farmville, and the upper one, you see that some of the letters are just switched a little bit. But because all of these characters are mostly the same and they are still nearby to each other, even though they aren't literally the same exact word, the Jarrow-Winkler distance would say that these two words are a match because the characters just have to be near each other. They don't have to be in the same exact place. If you have two numbers, then the data sets are merged based on like numeric similarity. And also we're going to block for efficiency because the GVA and the MBDRS data set, they're these huge data sets, and it would be very computationally difficult to try to merge everything all together. And so I'll talk a little bit more about what that blocking means. So the methodology that we use to carry out this project, just as an overview, first we cleaned the data sets. Then we applied FastLink, and then we verified whether or not they are true matches or not. So with the data cleaning, for the GVA, the gun violence archive data set, that has very specific neighborhood level information, which is great for us, but they don't have zip codes in it. So we used another online platform called Geocodio to add zip codes to that GVA data set. We also added the longitude and latitude data to the NBDRS data set. Then to use FastLink, the variables of interest to us that we want to match with also have to be the same name. So we did a little bit of cleaning with that. Also, the NBDRS contains all violent death incidents, but we only want to consider the ones where the weapon used and the death cause involve some type of firearm. Also, I added a days since start variable so that we only want to match incidents that happened around the same date. And finally, we only kept states from each year that were well represented according to the CDC surveillance summaries. So depending on the year, there were like in 2014, there were like 18 states that were well represented. And we only kept the data from those 18 states. So with that clean data, how did we use FastLink then? So with the NVDRS and the GVA data sets, we first blocked. So we blocked by state. So for example, the NVDRS, block 1 would be all the data sets that happened with incidents that happened in New Jersey. Block 2 would be everything that happened in Pennsylvania, and so on for every single block. There would be a block for each state. And we did that also with the GVA data set. Now comes the FastLink part. So how are we going to define whether two records are a match? Well, the variables of interest to us will be the injury city, the day since start, number killed in the incident, and the injury zip code. So with that, for each block, we want to get the matches. So for block 1 from both data sets, we get those matches. Block 2, we get those matches, do it for every single block. And then finally, we merge all of those matches into one big data set. So in total, with the NVDRS, we had 30,000 records after cleaning. GVA, we had about 36,000 records. We did FastLink on the variables of interest to us, and we determined that 27,000 records were matched. Now, with these 27,000 records, though, how do we know whether or not they are truly the same incident? Like, are the matches accurate? So here we had to do some manual verification. So the NVDRS, they already had these detailed narratives, but we want to compare them with the GVA to see if they are actually true matches. And the GVA does have a few incidents where they have detailed descriptions of them. So on their website, they have this thing called standard reports. And I took some of their data sets from those reports. For example, like children killed, teens killed, and all of those mass shootings. We don't want to consider the accidental deaths or injuries because the NVDRS doesn't consider those accidental ones. So we only look at the ones that I've blocked it, like have boxed in here. So using those data sets, we then use the same cleaning criteria that I used previously. For example, like only keeping certain states that were well represented according to the CDC and getting that days since start variable. And with that, that leaves us with 1,263 records after cleaning. So our merged data set, it had 27,000 records, but the GVA online reports only have 1,263 records. So we want to see which of those GVA records can also be found in our merged data set, and we only want to compare those incidents. So out of the 1,200 records from the GVA, we took those incident IDs, and we found 942 of those incident IDs also in our merged data set. So now we have 942 records that we can compare. We can look at the NVDRS narrative, and we can find them on the GVA website to see their descriptions and see whether or not they're matches. So for each record, we manually compare them, and records are classified as true matches, false matches, or undetermined if there wasn't enough information available. With that, we had a 90% accuracy rate. So about 90% of the records were actually true matches. So overall, there were some limitations, as you saw. There was limited GVA records online because there was only 1,263 records on their website. We could only compare 942 manually. And so ideally, there would be more records that we could compare to see if they were actually true matches. Another limitation was also the manual verification of matches, which might be subject to human error. However, this work does seem very promising because we had a 90% accuracy rate. So with this now big merged data set, it can now be used to further look at the effect of different racial compositions on neighborhood gun homicides from a nationwide level. And that big merged data set could be used in future studies to try to look or explore more into this relationship between gun violence and neighborhood racial composition. And so thank you.
Thank you, Iris. Appreciate it. Good talk. I have to say, I thought these were really three excellent talks. Particularly, it's always great to start with good problems. It's hard to have a useful work without taking on something that needs being addressed. And there are three great examples with taking on very different angles of the overall gun violence problem. I'm gonna also just throw in my little side comment that I really love social science. When you get in down and dirty, you can come up with terms like scrounging as part of your approach. It seems like we're getting into the essence of the matter there.
I think we have a question from Roseanne.
Hi, I couldn't figure out how to use the Q&A. I apologize.
Okay.
I'm not, and I'll just take the privilege of being a panelist. I have enough questions for all panelists, but I will start with just one, which is for Susan. And you've done so much thinking on this, and it's so encouraging that NIBRS is considering or has approved this movement forward of capturing this broader set of kind of incidents related to gun violence. I don't think they've implemented it yet, but assuming that they do at some point, have you, I guess I'm curious as to your thoughts about whether you think we're going to be stuck if we want to consider that broader set and do longitudinal analysis only looking forward, or is there a way to stitch together a bunch of these data sources, police, hospitalization records from before, and kind of stitch them all together so we could do something a bit more longitudinal looking previously as well?
Yeah, that I think is such a great question, and I don't think I have all of the answers. I think one thing that we have found out is that the FBI will continue and has continued the old summary reporting system, right? Because NIBRS can be transformed and essentially flattened into the summary reporting system. They say that they're not going to continue to do that for forever. We don't know what that really means. So you can always flatten NIBRS into, okay, this was a gun crime, an assault with a gun, a robbery with a gun. I think that's a great question. I don't have a great answer. We might be able to do something where we bounce emergency department data for like the full count off of like NIBRS for the assault count potentially, and like go back in time that way, because we could say like, okay, like you turned up in the ER, you turned out with a gunshot wound. That should be really close to NIBRS if police know about all of the gun crimes, but we don't even know if that's actually true. We think that mandatory reporting should mean that the numbers are close. Hospitals have this like obligation to tell police when they treat a gunshot wound in case police don't know. We don't know if that's actually working very well either. So there's a lot of like open pieces about this, but I think that's exactly the question, because we are going to be in a position where we lack longitudinal data. I think that probably, at least the way I'm thinking about it right now, is like, under what circumstances do we hospital data gives us gun injuries, like we know the patient's zip code, we know the patient was treated, we know exactly when the patient was treated. It's pretty good. When do we really care about disaggregating assault? And I would say that for things like safe storage laws and a lot of the laws that are like, we're like forward looking on the books, maybe we don't care. We'd love to prevent assaults and injuries. And so I think some longitudinal questions, we might be able to get away with really using health data, but the health data isn't cheap. It's not available. It's not, it's like cleaning to get a national count of everyone treated for a gunshot wound in a state for the last 3 years. You would have to open 50 times, you'd have to open 150 data sets, to do this. This is just not.
Working on it. I'm working on it.
That's great. That's great. Actually, like, as you work on that, I'm sure you know this, but like the reuse agreements appear like we could do something about that too. The reuse agreements appear really, the health agency for health, I'm going to mess this up, HCUP.
Healthcare Research and Quality.
Thank you. They will let you reuse all of your work, all this wonderful work that you're doing to build this data set, I think. And they used to actually provide these counts. It would be great if someone could step in and do that.
Thanks.
Thanks for that question.
We have another question for Susan in the Q&A, but I think others might have comments on this too. Susan, have police data been reviewed to explore their accuracy with documenting police-involved shootings?
Yeah, this is a great question. I know that we're going to have a really nice talk about that. I think Justin Nix will be talking a bit about police shootings. So the FBI collects data about police shootings. They have a threshold for release. This isn't part of NIBRS. People have differing opinions about this. Some people think that law enforcement agencies would be less likely to report if they have to report information about police-involved shootings through NIBRS, and we have this big reporting problem with NIBRS already. Maybe we don't want to make that worse. Others, so I think, I don't know which one's right. There's a bunch of different perspectives about this, but no, right now NIBRS does not have information about if the shooting was, say, involving a police officer. We know separately if the officer was injured through a different data collection that the FBI does.
Do the panelists have any questions for each other? We have 4 minutes left.
Iris, I guess I'd be curious to hear more about what your plans are with the data, having managed to, do this this record linkage.
Yeah, we're really excited about it because now we can link the NVDRS dataset with the GBA dataset. And now we're looking to try to go back to that original paper on the neighborhood racial composition and gun homicides paper and try to see, like, was there any spillover effect that was seen, or do we get that same result of seeing that like gun homicide deaths are still increased with higher proportion of Black residents? Because now we have like way more information about the demographic details, and we can see, oh, like in this specific neighborhood, what were really the specific like racial compositions. Yeah, so that is like future work that we're like working towards. Thanks for the
Very
question.
cool.
I think I keep screwing up the hand raising thing, but my question was for Charles. Like, I was looking at the distribution of different types of carriers that you had, and I guess I would have hypothesized, and maybe you haven't like formally tested this, but I guess I would have thought that, people who are carrying in their cars, is there any kind of like geographic blocking you can do? Like someone who's much more likely to be like a illicit car carrier should have much less of an ammunition shortage maybe than someone who's more likely to be an illicit carrier, and maybe you could proxy by neighborhood potentially on that. Were you surprised about those distributions, or what would you have expected to see the constraint facing different kinds of consumers based on that police stop?
Yeah, so this is a great question. And I think in Boston, we're probably not going to have the best visibility into this. Most police actions are going to occur in, for those of you familiar with the geography, as Susan, you are, like a few neighborhoods. And by a few, I mean Dorchester and Mattapan. And so I don't think we're going to get a lot of geographic variation. However, we're now looking at data from a number of other cities, including San Francisco. And one of the nice things there is that we actually have full NIBIN checks on the firearms. And so it becomes possible to essentially say, no, this was in fact a crime gun. And so you can essentially partition your recovery, the people from whom the firearms recovered, into those who might actually be sort of licensed in some fashion, if not completely, to those who just like are totally outside of the regulatory framework. And so it could be, we can do a sort of more careful comparison along the lines that you're thinking of, and see whether one side really is, as you would expect, much more constrained than the other, which would be a nice sanity check for whether these measures are doing what they're supposed to. Great question.
We have 1 minute. Let me give a lightning round. Other than your own research, give your first thought on what would be a great new direction for research in this area. Charles, why don't you go first?
Well, I'll tell you something I haven't done, but I've encouraged other people to do, which is we think a lot about how we measure gun violence. And, we've talked about deaths, we've talked about non-fatals, I talked about ammo recovered. The other thing that we just haven't measured really, which would be another whole project, is just saying, given how many people use semi-automatic pistols now, that's the vast majority of all shootings, a very direct measure of how much intentional effort to produce violence there is in a society is the number of recovered shell casings. This is like actually like a direct measure, and we don't measure it.
Cool.
So that would be one direction.
That's it. That was a lightning round. That was great. Susan, how about you?
I think that highlighting NVDRS like Iris did was amazing. There's so much in NVDRS that we are just starting to scratch the surface of. There's rich text data if you're a natural language processing person. There's a lot of police outcome data. If you're a criminal justice researcher, I think there's a lot there. And so that's less so a avenue, but I think mostly just a
Ooh, I lost your last couple of words, but that was great. Iris, how about a quick answer from you?
Yeah, I feel like there's so much like research that could be done in like this area. Maybe like if there's so many like different data sets, is it possible to like have all of them in one like really nice database frame? And so it's like easily accessible to all researchers, and like analysts could like you can do analyze the data very easily, I guess.
Great.
Yeah.
An excellent goal. Well, thanks very much to all our presenters and to the audience as well. Our time is up, and so I think we.
Oh, you muted yourself, Wayne, but thank you for chairing that session.
And on to
Thank
the
you,
break, I think. Thank you.
You get 4 minutes remaining of the break, and then I think Claire can come back on and introduce the next panel. Thank you all.